asking the question, I want to thank the families and the family members in this room and throughout Vermont who provide the passion and so much of extraordinary good energy for us to have what was the best system in the country. And as governor, I'm going to rebuild it. Now, I have said, just to articulate the differences between me and the Douglas Dewey team, if we stay on the path that we're on, we better bring back Brandon. We better build a state hospital, but a pretty big assignment, frankly, because we won't have the community-based care that your daughter and that so many Vermonters are relying on right now. I mean, that's why this debate in this election is so important. So I'll tell you as governor, I've given you ideas on where I think we can get huge chunks of money when we're spending $50,000, $60,000, $70,000 for one individual, putting them behind bars because they have substance and alcohol abuse issues. What do we know about that population? We know that 97% of them have difficulty reading, that 98% have substance abuse issues, and the list goes on and on. We take those resources and ensure that we keep our community-based system alive and well. Listen, I think it is a value of Vermonters that we stand by you and stand by the community-based system that we have developed so thoughtfully for the past 40 years. The last 8 years, let's make that the exception to the rule. We must win this election. You'll notice that the 5 of us are good friends. We don't pick on each other. You all pick the best candidate. I happen to think I'm that candidate. And we'll work together to make sure that we get the community-based system back on track so you don't have to worry about whether or not the system is going to be there for you. You can provide the most loving care to your daughter and use your energy.
Erica, thank you. And I believe that we need to, all of us as candidates for governor, make that commitment to you and to your family. Going back to institutionalized settings is simply not acceptable. And to me, I was around in the Senate when we were moving folks out of Brandon into community-based systems. And I met a lot of people who had been in the Brandon training school, and it was appalling to me that they had been institutionalized because they were active members of our society. And to me, it's really about the human dignity of each one of us as individual Vermonters, and that dignity needs to be respected. You have my personal commitment that we will find the resources to maintain family supports. And I look at the budget presented by the governor, and it was severely undermining those supports that families need, and not just the families of folks in this room, but the families of our elderly citizens and the families of many of our children. That cannot be acceptable to us. And I think we need to look under every rock. And we talk about setting different priorities, and we talk about federal money. We talk about making more efficiencies. However it's done, that commitment needs to be there. And I'm going to tell you as governor, if we can't find the money in those other places, I'll make those tough decisions, and I'll go to Vermonters and say, this is a fundamental value of our society, and we need the resources to pay for this. Rainy day funds, revenues. Last year, higher income Vermonters, middle income Vermonters got a tax cut in the middle of these serious economic crises. I disagreed with that then, and I disagree with it now. We're all in this together. We need to look at these budget issues as a community and recognize that we are one community, and we all participate in getting us through this. That's what Dick Snelling did in 1991, and we emerged with a stronger economy, and we were a stronger state.
Thank you. I just want to make clear that I disagree with Doug's view on the tax question. And you got to know that I was part of the budget process. We asked wealthy Vermonters last year to pay a little more by getting rid of the capital gains exclusion, the estate tax, and a few other methods. And that's one of the reasons we had to override the governor's veto on the budget. The result was that we did ask the wealthiest Vermonters in tough times to pay more. When you talk about the selling tax cuts, I was there. I was on finance when we implemented those cuts. It was a good thing. But the top marginal rate was at 6%. It's now at 9%. And I don't believe that we can, I think it's fantasy to believe that we can solve our budget problems with higher taxes. We have to do it with new ideas.
All right, back to the main question now.
Did I rebut that one?
Let's hear from all the candidates.
Seriously, no, that is, I think, should be rebuttable, please.
Well, the only thing is there are 5 people on stage.
I'll be really.
It's okay, we're okay with this?
Okay.
15 seconds. Here you go.
Really brief. Last year I voted against the budget because as a middle income Vermonter, I got a tax cut, okay? Some higher income Vermonters got hit with higher taxes. Most got a tax cut. And I couldn't in good conscience vote for a budget that had the types of cuts that you people had to absorb and take a tax cut at the same time. Thank you.
Back to families.
I am committed to family-based care for a couple reasons. I mean, one is we all know it makes a real difference for quality of life to keep families intact. The other is practical and budgetary. It's much more expensive to institutionalize. So that's not a great option. And if we're not providing families with the right kinds of supports, it means that the adults in those families or the parents can't go to work. And it affects the family's ability to stay at home, provide for each other, and can't have that kind of quality of life. And in some cases might lead to the only option being institutionalization. You know, look, we closed Brandon Training School for a good reason. It was the right decision, and I'm committed to making sure that you all have the supports you need to continue to make it work.
I do not believe we have completed the transition from the Brandon Training Center. I do not believe that we have actually listened to the consumers, the families who are grappling with the issues day after day to make sure that they provide the best experience, quality of life, and family for their child. We can do more, and I hear from Vermonters across the state things that are very practical in terms of being able to have transportation in rural areas, the ability so that once a young person with developmental disabilities can go out on their own, that they can actually get to a place and back. I also hear about isolation and about feeling alone, especially in our more rural areas, where the feeling is that you're the only person who is dealing with this, and what you want is a network of people. And a lot of work has been done to pull together those networks, but so much more can happen, and the power of that larger community, especially when a family is starting off down this road, is incredibly important, and we're not doing enough to do it. We've seen the benefits of making sure that Vermonters stay in their home with home health, and we have seen it in the developmental disability community. The comparison that I have to it is my own cousin, Johnny, who unfortunately was in California in a time of institutionalization. He was born with autism, and it took his parents fighting tooth and nail to keep him from being institutionalized because they believed it would be better to not have him institutionalized. Today, Jonathan has a degree from college, he drives, he was actually on National Public Radio talking about his experience. That's not going to be true for every young child with autism, but the opportunity that provided, as opposed to being locked up in a Brandon-like location, is the kind of opportunity that we need to make sure that every young person in Vermont has, and has to the best.
We have not lived up to the promises that the state made with Brandon. And one of the interesting and wonderful benefits that no one anticipated when we closed Brandon is that by putting folks out into the community, and whether they could be back with their families or in community care homes or in group settings, people who had been very despondent and not particularly productive suddenly became really positive members of our communities. And because they felt much better, they have lived much longer. And what a great side benefit that has given all of us in the state. The practical problem that it gives us is we now have more folks that need supports in our communities. One of the reasons that I want to have us have an agency of human health is because it's easy when you're talking about you have a child and you're working really hard to keep them, you're committed to keep that child in your home, and good for you, and I totally support you in doing that. But we have to not just be cognizant of the services the child needs, we've got to treat you as a whole family. We've got to make sure that the support is there for the parents and the extended family members, because it's a lot of work and it's a lot of strain when you have a severely handicapped person living with you. And it's really important that we take care of the whole family. As your governor, I am totally committed to making sure that every Vermonter has access to becoming the best person that